issues deserve to be treated just like anybody with any other medical problem. So I don't care what your politics are, don't want to hear it. The problem is money. Where are you going to get your money from? And if you're going to stop Obamacare, that's great. What you're going to put in its place. That's all I want to hear. Okay? Now, I'm going to wrap this up.
Yes, thank you, Barbara.
What can we do right now locally? I have a 4-point plan.
Oh.
I even have some handouts, because I used to be a teacher back in the Stone Age. So somebody could hand these out. Okay. I have a 4-part solution. First one, homeless programs, back to lack of coordination. Homeless programs need to report their intakes to the LA County Department of Mental Health. LA County Department of Mental Health cannot give out information about particular people, but they can receive all kinds of information. So they need to know who's going through. Right now, we don't know who's going in and out of the mental health of the homeless programs on a systematic basis. Now, this is going to make it possible for county mental health to check their computers to see if some of these people already are in paid status but suffer from mental illness. You follow me? The next thing that would happen that I suggest is that we petition the Board of Supervisors to create a Department of Public Trust so that when the people who don't manage their money well, they have a right not to take medication, that's fine, but the Department of Public Trust can then become payee for their monies. And then there can be some control over where that money is spent so that it can be spent for housing appropriately. So because we know that after the first 5 days of the new month, many people are out of money because they spent it all, okay? This would relieve family responsibility because we have a lot of elderly parents who are sleeping with, and they are putting, I have one lady that puts a dresser in front of her door every night because she's afraid of her son, but she doesn't want to call 911 because she's also afraid of the police and what they might do to her son. And so we need to amend the law for elder abuse to make elder abuse automatically investigated whether or not the person is willing to sign a complaint, just as we have done for child abuse and domestic violence. And this can be done on the local level. And finally, with housing, we call for a countywide summit on housing that will have all the stakeholders involved, including the federal government and HUD, because nobody's mentioned sequestration and how that's affecting Section 8 vouchers, state licensing for boarding care, and we need to address the need for a broad continuum of housing, not just boarding care or not just being on the streets. We need a lot of supportive services, and I thank you for listening.
Thank you, Barbara.
Thank you. One more thing, I do have handouts, but if anybody wants to join in this struggle to get us back to being number one, I have sign-up sheets, I'll pass them around. I have a question.
Questions are at the end.
Yep, okay, coming up next. He flew in all the way from Boston, Massachusetts. Philip, going once. There he is. Yes. I don't want to hack up your last name. Mangano. Philip Mangano. Thank you for coming.
I'm happy to be here, and I appreciate the invitation as well. I think if this is about homelessness and mental health, I think we have to recognize first who is a person who's homeless with mental health. And they do have a name, don't they? All of them have a name. And that name is neighbor. That's who they are. They're our neighbors. And we learned when we were pretty small what our responsibility was to our neighbor. Whether you were in a religious tradition that taught you that, or you were just living in a neighborhood, you knew that your responsibility to your neighbor was to love them and do for them what you would want done for yourself. So that begins to shape, when we think about policy and resources, that shape. We have to do for our neighbor what we want done for ourselves. What we've learned about homelessness over the years, of course, is what? That if good intentions, well-meaning programs, and humanitarian gestures work in your community, your neighborhood, and in communities all over our country, homelessness would have been history, wouldn't it? There's been a lot of good intentions, a lot of humanitarian programs, and yet what we see around the country is the number is starting to gurgle up again instead of going down, including right here in Los Angeles. So if something's not working and we want to solve a problem, we need to change that strategy, or we fall prey to what Einstein taught us, don't we? The president talks about this a lot. Trying to do the same thing over and over and over again, expecting a different result. It doesn't work, does it? You could light a candle and it still won't work. So we have to figure out a different strategy of how we need to proceed. Here's the good news on this issue that you're dealing with tonight. We know what to do, and we know how to do it. We know how to address our neighbors who are homeless and mentally ill. We know how to organize housing targeted to their lives, and we know how to organize the services that support their tenancies. Because you need both, don't you? Because what we learned all during the 1980s and the 1990s was this. Servicing homeless people without housing leaves them out on the street and in the shelters. But housing homeless people without the services to support their tenancies sets them up for failure. We've already heard tonight about deinstitutionalization, which actually began in Massachusetts, one of the most progressive states in the country, in 1976, long before Ronald Reagan was president. It began deinstitutionalization under a very liberal Democratic governor. So one of the things we know about homelessness is there's no D or R on this issue.
Thank you.
We're just Americans trying to solve a difficult problem. We need the best ideas from the D side, the best ideas from the R side, and the best ideas of independence as well. It's about time we had one problem in our country, don't you think, that's not subject to partisanship? Can I get an amen on that?
Amen.
I knew you were living out there. I don't think it's unconstitutional yet to say amen, right? It's
Amen.
still...
Amen it
it's
up.
still not unconstitutional, so I'm glad to hear that.
Exactly.
So how do you get the housing and the services? We know what to do, we know how to do it. How do you get them? Well, one of the strategies that's worked literally all over our country to motivate the political will. Because as you know, without the political will, and our previous speaker was right, without government, you're not going to get this job done, are you? No. But in fact, you're going to get it done locally. We've tried in Washington. I served in Washington for 7 years. We tried to get it, we tried to solve it inside the Beltway. It doesn't work. You need to solve it locally. That's why I applaud this group. I applaud George for organizing this group, because you're going to ultimately solve homelessness locally, but you need resources from Washington to get it done. Here's what's motivated, here's what's initiated and sustained political will to get those resources. You think it's out of the heart? It's when we look at homeless people and recognize that they were randomly ricocheting through very expensive systems in our community. They're often in the emergency room of the hospital. They go to substance abuse and mental health programs, always accessing them at the acute side, which is the most expensive. It's like going for all of your physical health in the emergency room of the hospital, right? Also, police, and I know there were police here earlier. Police are interacting. Firefighters are responding to 9/11 calls. I was just with a police chief in another state. He told me his officers in the fire department are constantly going to 9/11 calls to the tune of $2 million a year just in their response. Court judges, jailers. When you add up all of those costs from all of those different systems, here's what you find out. Homeless people, especially homeless mentally ill people, they're the most expensive individuals to the public purse in the community. How expensive? When we did studies in Washington, 70 different cities reported to us. The range of that cost of that random ricocheting of homeless people going through all of those systems, that range was from $35,000 to $150,000 per person per year. $35,000 to $150,000. And what was that for? To sustain people in their homelessness. Talk about something being crazy. That's public policy. That's crazy. When we looked at the intervention of housing in the lives of those homeless people, and how much did that cost? The cost of housing, literally ending a person's homelessness, that range in those same cities was from $12,000 to $25,000 a year. So you could spend $35,000 to $150,000 to sustain people in homelessness, or $12,000 to $25,000 to solve it. You don't need to be Warren Buffett or even Susie Orman to understand which of those investments you should make. And mayors and county executives and governors all over our country had their political will, their political instincts awakened by all of these cost studies. Right now, here in Los Angeles County, which never did a proper cost-benefit analysis, there is one going on right now by a Dr. Dennis Culhane from the University of Pennsylvania. He's the foremost homeless researcher in the country. He's conducting that study. You know what we'll find? The same thing is true in Los Angeles. Very expensive for a person to be in homelessness, much less expensive to have their homelessness ended. Those cost studies all over our country, in Seattle, in Denver, in Miami, and in New York, and in Chicago, San Francisco, Portland, they've initiated a level of political will unseen on this issue, not subject to the vagaries of emotionality around this issue. When you put it in dollars and cents, when you drive the nonsense out and get to common sense, there are reasons to end homelessness. If altruism and good-heartedness, if that's dead in you, if it's dead in politicians, if it's dead, there are economic reasons to bring homelessness to an end. And we know what they are, and the cost study that's happening in Los Angeles will further reveal that here. What we're talking about is finally taking all of the money from philanthropy, from you all, from the state, from the federal government, from the local county, from the city. And instead of just funding things, we're talking about making an investment. And whenever any of us makes an investment, what's the one thing we're expecting from an investment?
Return.
Amen. The return on this investment that we're looking for, and we're seeing it all over the country, and we need to make sure this happens here in Los Angeles. That return is fewer people on our streets. Should any person who has served our country, who is subject to a disability by virtue of mental illness, should they be on the streets of our community? That's a disgrace, is it not?
Yes.
Amen, don't you think? Amen. Well, we need to be investing in those lives. There's a reason to make the investment, because actually that investment saves money and it saves lives. So we have an opportunity here in Los Angeles, with good people like you rallying to the cause, to do something that's better for our community, moving people off of our streets and into a place to live, with the services that support their tendencies. We have something to do that's good for our homeless neighbors, to make sure they're not suffering the long misery of homelessness. And third, and who would have guessed it, we have something good to do for the taxpayer, because it's less expensive to solve the problem than it is to simply sustain it and manage it. That's a trifecta. Better for the community, better for the homeless person, better for the taxpayer. That's a trifecta you won't get in any racetrack in California. But you can do it here in Los Angeles by virtue of that kind of investment. Now, if you don't believe all of this is possible, if you don't believe that homeless mentally ill people can go into housing, sustain that housing, and live a productive life. There's a man named Todd Lipka right over here. He runs a program called Step Up in Santa Monica and Hollywood, and he's been doing some other work around the country. Todd Lipka runs Step Up. Wave, Todd, so they know who you are, so they can accost you. He's run these programs, and what he's discovered is it costs less, it's better for the person, and it's better for the taxpayer. That's the direction homeless policy needs to go. That's the way we need to pull together to get the job done. It's all available. We know what to do, and we know how to do it. So let's get it done. Thank you.
Yes.
Thank you very much.
Thank you very much, Philip. Up next, we are going to bounce back to Congressman Tony Cardenas' office. His chief of staff has flown in from DC just for this. Probably he's doing nothing else. Thank you.
Back again.
Yes, Sam Jamal.
Yes.
Anytime they're hosting forums, I'm coming back. You guys are my flight home.
Good to see you, sir. So this is Congressman Tony Cardenas' chief of staff coming in from DC. Thank you, sir, for coming.
Thank you. Thank you guys for hosting this forum. It's really great to see the work that this neighborhood council is doing to bring the community together and talk about different issues that are important. And really, you know, I saw on the agenda you guys had different folks from local, state, as well as the nonprofits and on the federal level. That's the way to do it. You know, I think, as the gentleman before me said, it was wonderful in his remarks, and definitely want to chat with him after this. It's, you know, the federal government, what we can provide is the dollar side, but we really need, you know, the money's great, the authorization's great, but it's the folks on the ground who are doing the hard work that really make a difference. So thank you all once again for having me before your group. My name's Sam Jamal, and I'm Chief of Staff to Congressman Tony Cardenas. Based out in Washington, D.C., but occasionally back and forth with a couple folks in our district team here, Brian Gavidia and Kenny LaSalle. And so, you know, the Congressman unfortunately couldn't make it tonight. He had a prior engagement, but he wanted to make sure I come and check in with you all and our team, listen to all the good work that's coming out of here, so we can go back to report to our policy staff in D.C. and our friends in the Obama administration, and, you know, hopefully compliment and highlight the good work that's being done on the ground. You know, I'm going to talk briefly about some of our office's particular focus on veterans homelessness, and just generally the work on the federal level. Homelessness, in particular veterans homelessness, is a shared responsibility for all of us. These are our heroes, these are our folks that are, you know, fighting for us overseas, and unfortunately it's still a plague in our society that we have folks coming and returning and not being able to get back to work, having a hard time to get the health care and services they need, and too often ending up in homelessness. For Congressman Cardenas, this is a top priority. It's why he's worked closely with his colleagues in both parties to help reform the Veterans Administration to make sure it's accountable. I think in the news last year, we all saw the different stories of the unfortunate instances with the claims being processed, and that's unacceptable. Completely unacceptable. The Congressman has had several meetings with the folks out here locally, as well as the national folks, to see how do we make sure that never happens again. Is it a resource question? Let's get the resources there. Is it a question of ability to use the tools and needing more tools, not just money, but also, you know, flexibility of the law? Let's make sure they have that. And so, you know, President Obama signed legislation this summer that was bipartisan to start to address that, but it doesn't stop there. The implementation matters, and it matters to hear from folks as problems come up, because that's our one-stop shop to really end veterans homelessness. In addition to that effort to modernize the VA, you know, we're doing our own review with our Veterans Advisory Committee, which Brian over there helps lead, to talk to some of our local folks and figure out what we can do to continue to put that pressure in Washington.